Today's topic is a common injury seen in people who work out in the gyms or a housewife who takes a very heavy object like a gas cylinder or a pressure cooker. There will be sudden pain on the inner side of the wrist. Now, as we know, we have the main joint which helps in this motion. We have a smaller joint here which helps in twisting. Now, any damage to this joint will cause a sudden sharp shooting pain, and the reason is when the hand goes in this direction when lifting weights. This is not a good position to be in, especially in loading. What happens is these two edge bones they jam against each other. So suddenly when they take a pressure cooker and slips, the hand will suddenly go in this direction. Or when they're lifting weights, and especially the weight is very high, there's a tendency of the wrist to deviate like this, which is not very healthy. Now the treatment is the issue here. We have to prevent rotary action. So the patient will need some days of immobilization. Now if I put a plaster only below the elbow, what will happen? They will be able to twist their hand. So ideally for 3 weeks, we'll have a long or above elbow cast. Because only if I put the plaster above the elbow will this action be nullified. Usually the prognosis is good, but for some people MRI may be needed to assess the extent of damage, and treatment will be tailored accordingly. Thank you.